Hi, my name is Juliet, and my presentation topic is spinal cord disabilities. So a spinal cord disability is the result of an injury or developed disorder that impacts the spinal cord and then therefore the central nervous system. These disabilities can result in a complete or total loss of function or incomplete loss of function in the body, depending on where the spinal cord is injured and the severity. So some examples of spinal cord injuries are a motor vehicle accident, a fall, an act of violence, such as gunshot wound, or a sport or recreational injury. Some spinal cord disorders are myelopathy, degenerative disc disease, a spinal tumor, or MS. These are among many other diseases or disorders that can impact the spinal cord's function. So the anatomy of the spinal cord and the brain make up the body's central nervous system, which integrates sensory information and controls motor output. So in particular, the spinal cord controls the conscious and subconscious functions of the brain. So whatever the brain interprets, the spinal cord kind of carries out. And it houses many of the nerves that control our bodily functions, such as our muscles. The spinal cord passes through the spinal column, which then has 4 different segments, the cervical, thoracic, lumbar, and sacral, that each have different nerves integrated in them that pass through the vertebrae and control different segments of the body. So you can see in the diagram, the cervical is C1 through C7, and that's kind of the upper body. Thoracic, T1 to T12, which is the middle. Lumbar is L1 to L5, which is lower. And then sacral is actually a fusing of 5 vertebrae, kind of near your pelvis. So the nerves that run through the spinal cord are also characterized by either sensory or motor. So the anterior or ventral, which you also will hear, controls motor, and posterior dorsal controls sensory function. And then in the diagram below, it also does have another name. Afferent is sensory, which is into or up to the brain, and then efferent is from the brain outwards, so motor. So spinal cord injury. This results from damage to the vertebrae, ligaments, discs, or even spinal cord itself in worst case. The spinal cord is unlike other parts of the body because it cannot repair itself. So an injury sustained is very hard to kind of reverse and pretty impossible. The spinal cord injury can result in a loss of movement, a loss of sensation, loss of bladder and bowel control, uncontrollable spasms, and pain or intense sensation in many different areas of the body. The severity of the injury impacts the remaining sensory and motor ability as well as the location of the injury. So a complete spinal cord injury is a loss of all sensory and motor function below the site of injury, and then an incomplete is some sensory and motor functions still remain below the site of the injury. The location of the injury, like I said, also impacts the remaining functions. So a tetraplegia is loss of motor function and sensory control in upper limbs, lower limbs, trunk, and pelvic organs, so basically from the neck down. And paraplegia is loss of motor and sensory function in the trunk, lower limbs, and pelvic organs, which in most cases is waist down. So here are just some statistics. Approximately 12,000 people suffer from a spinal cord injury every year in the United States. And then an estimated 273,000 people in the United States do have a spinal cord injury. And it says about half are between 16 and 30. And then the other diagram is basically just showing the more common injury. So an incomplete tetraplegia is the most common. And then complete tetraplegia is the least common. And then just some causes. Motor vehicle accidents are the most common cause of spinal cord injury. And then comes everyday falls. So then a spinal cord disorder. Some diseases or disorders that people develop or are even born with may impact the central nervous system and disable the functions of the spinal cord. It can be regulated with treatment, therapy, rehabilitation, but they do have a decreased nerve function and it's impacted on the spinal cord. Some disorders such as MS emerge in young adults mostly and are developed over their lifespan and can be regulated, but others, such as a tumor, can cause irreversible effects such as no mobility in limbs, things like that. So diagnosis and treatment, starting with diagnosis, the quicker the patient is diagnosed, the better the chance of recovery. So basically, the less injury to the spinal cord, the better. And they should have a medical and family history known. Pain or weakness and loss of sensation can indicate injury. The best way to diagnose is through x-rays, CTs, and MRIs, MRIs being the most intricate. They can identify tumors, fractures, dislocations, or other obstructions like inflamed discs. Treatment, initially the patient must be immobilized and all injury kind of fixed. Some patients require surgery to relieve the pressure or to reconstruct the spine in bad cases. There's no known cure for an injury to the spinal cord, but rehabilitation can keep the muscles active and improve the patient's quality of life. So here's just kind of a flow chart. A traumatic injury being like a sudden injury to the spine, and then spontaneous kind of a development of a disorder or something like a inflamed disc, tumor. So in both cases, you need some sort of history known, any sort of medical history or even family history. And then an examination always required. And then there's the x-rays, CTs, MRIs, and then lots of treatment, starting mostly with bed rest and kind of fixing the spinal cord up. So some risks that do follow along with a spinal cord disability: they're more likely to be hypotensive, pulmonary dysfunction, kind of the blood flow throughout the body is impaired, osteoporosis, so losing some bone density, sarcopenia, so loss of muscle mass, and obesity from inactivity. So just some spinal cord risk factors. So you can kind of see how each injury is impacted by age, gender, kind of activity, different things like that. So it looks like the male gender is more prone to a spinal cord injury than the female. So for my case study, I have a 50-year-old male who recently obtained an incomplete lumbar spinal cord injury. So he still has some function in his legs. So he has sensation and a little bit of mobility, but has lost some. He is 220 pounds and 6 feet tall, blood pressure 140/85. He is relatively active, participates in recreational activity 3 times a week for 60 minutes at least. His father did die of a heart attack at 53 years old. There are his fasting blood glucose, cholesterol, HDL, LDL numbers. And like I said, he lost most of his sensation in his lower body, and he is losing muscle mass because of it. So he is 50 years old, so it is a risk factor for him. He is not technically obese or overweight. He has a BMI lower than 30, so that's not a risk factor. His blood pressure, technically his systolic blood pressure is a risk factor because it's 140. His exercise history, he participates at least 3 times a week for 60 minutes a day, so that's not a risk factor. His father died before the age of 55 of a heart condition, so that is a risk factor for him. And looks like the only risk factor with those numbers are his fasting blood glucose. So he has 4 risk factors, and the patient is at moderate risk. So the goals of the patient is he would like to regain some of the strength in his legs and maintain a healthy mobility and his muscle tissue. So maintain that like healthy muscle tissue, because the more muscle tissue he has, the healthier he can be. He would also like to improve his upper body strength because he is now in a wheelchair and struggling with keeping up and being able to propel himself throughout the day. Some special considerations: so the patient has limited mobility in his lower body and is going to need assistance and supervision at all times, especially in his lower body. He's lost sensation, so slowly progressing and introducing him to the exercise is very important too. We can't ignore the upper body, so we have to make sure he is getting kind of an even disbursement of treatment. For exercise testing, cardiovascular, I chose arm ergometry. So start with a light warm-up, always increase by about 5 watts every 2 to 3 minutes. Monitor his heart rate every minute, make sure he doesn't go too high. Also pause for his blood pressure, take that every now and then, maybe every minute. And RPE every minute to know that he's not exerting himself too much. Strength test, upper and lower body. So start with a light-weighted warm-up, and we're going to do 1 RM testing. So 3 trials for his maximum strength. I chose chest press for upper body and a seated leg press for lower body. And then a range of motion test, so kind of an assisted stretching. So warm up with a focus on his joints that are at high risk, which are his shoulders, from using that wheelchair so much and propelling himself. And measure that with the goniometer. Make sure he's healthy or needs improvement. And the exercise prescription. So for aerobic, wheelchair or arm ergometry at about 50 to 85% of his VO2. And keep the RPE at 11 to 14. Make sure he's exerting himself, but not too much. This should be about 4 days a week and 30 minutes. And I chose in intervals, so he won't, or at least to start. And then progression. So slow progression, like I said, about less than 5% per week, up to 5%. The resistance, free weight exercises, because he is going to have trouble with his joints. So free weights do help to improve his joint function. About 10 reps at 60% of his 1 RM to start. 2 sets, 3 days a week, 30 minutes total, and increase the resistance and set him out slowly, so he'll eventually work up to maybe 3 sets. And then his range of motion, to increase that, have assisted stretching, focusing on his shoulders and his hips, his most important joints, and have 2 sets with 30-second holds, 7 days a week for 10 minutes about, and then we can increase the time with improvements in his range of motion. So in conclusion, the spinal cord is a sensitive, complicated, and very important part of bodily function. No matter the degree of the injury, we must take precautions in assessing the patient and providing workout protocol. To ensure positive results and comfortableness of the patient, we must be patient and slowly progress the exercise prescription to accommodate the injury. And there are my resources. Thank you.